Mm. All right. I am looking for just a moment to sit and relax. I'm standing, but relax with a great conversation on how we can improve our aging process from the inside out. So I've got an expert on the show who's not been on before. So welcome.
Thank you. I'm excited to be here.
Talk a little bit about who you are, why you do what you do. What's your mission?
Yeah, it's definitely has not been an intentional journey for me. So I'm a
Mhm.
dentist, and I thought that I would just keep doing what dentists do. My father's a dentist. He's still practicing in his mid 70s, and I thought that that was just my career track. And I really enjoy learning, and I was a cosmetic dentist, and everything was going along fine, but I really started suffering myself. My health just took a turn for the worse, and I didn't know what it was. So when you're not feeling well and you're a professional and you're busy and all these things, you just, start seeing doctor after doctor, doing whatever they tell you to do. But honestly, they weren't even telling me to do much. No one had very good answers for me. But my gut was just a mess. I couldn't even drink water without pain sometimes. So we, threw away all of our food like you do. You clean out your cupboards, you start all over, and it helped some, but it didn't help a lot. And my other two biggies were my memory. I couldn't even complete sentences at times, and I couldn't remember my patients' names from room to room. And that was very unlike me. But the big one was my hands. I had just painful numbness all the way down my arms and my hands to the point that I couldn't blow dry my hair. I couldn't sleep at night. I couldn't hold my dental instruments anymore. So this was literally career ending. I actually had my practice for sale and I didn't know what I was going to do. I was in my mid 30s, four young kids. My husband worked for the practice. I mean, this was devastating. So nobody had any answers. I was getting massages two, three times a week, chiropractor two, three times a week, and it just wasn't even making a dent in it. So finally, after I put the practice for sale, I was thinking, well, I've learned a lot about food now that we've thrown all of our food away and started over. Maybe I can teach nutrition. And so I started talking to a dentist who had a nutritionist in his practice. I said, well, maybe I could, be that in a dental practice. And he said, well, first of all, have you ever looked into mercury poisoning? Like your symptoms sound so much like mine. And that was the first time anyone had ever said that. And I said, well, no, I don't have any fillings. I mean, I knew that silver fillings were 50% mercury, but I didn't have any. I said, well, no, I don't have any fillings. And he said, it's not the fillings you have. It's the ones you've been drilling out for a decade with no protection. And again, the first time anybody had ever said that to me. So he said, well, isn't it worth getting tested? Because I said, well, no, 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 it's completely safe. The only thing we've been taught in school about these fillings is that they were completely safe once they were in a mouth. And if you talk about them or tell anyone that it could affect their health, I would lose my license. So that's what I was told. So I said, well, I don't think that I really want to think it's that. And he said, well, isn't it worth getting tested? So I got tested, and that's what it was. Mercury poisoning off the charts from drilling out fillings, because as I'm drilling on them, it releases the vapors right into my head and literally poisoned me. So I had to figure out, was there a way to do this in a different way? The doctor said, well, we can get
Mhm.
it out of you, but you can't keep putting it in if we're going to get it out. So I had to figure out how to do it. And there was organizations had never heard of that had protocol for removing these fillings safely. I started doing it that way. Patients started noticing, when your dentist walks in the room in a huge mercury filtration mask and a hazmat suit, they're like, I think something's
Yeah.
questions. They were always happy that I was doing it this way.
Well,
Interested.
that's such
My
a
doctor was talking about that. And so people started asking me other questions, things like, oh, hopefully the internet's not going to be bad here. So people started asking me questions, well, what do you really know about fluoride? And how about this
mm,
root canal thing I'm hearing about? And all of these things I knew nothing about. This was
mm,
not in my education. I knew nothing about it. And so
mm.
I'm the kind of person that if I don't have an answer, I go find one. So I kept seeking for answers, and what I found shocked me to no end. And now I've incorporated all of these things, what I call health-based dentistry. So everything that we do is focused on health into the practice. Now we have a multi-specialty practice. People fly in from around the world to see us because research shows 60 to 80% of chronic disease is related to your mouth in some way. So this was not a journey I expected to be on. This was nothing that I sought out, because I had this inkling that there was something missing. It was simply because I got sick. But now my mission is to help people live well. So whether it's through their mouth or whether it's through, the new book I just released with cellular health, all of these things is to help all of you not have to go through the struggles that I did.
I love that. I'm laughing because every time I talk to someone that is in a specialty, it's because they had their own experiences. I had my own health issues from doing all the right things, but doing too much of everything. And then just talking to different doctors and traditional medicine that switched to looking at become more functional medicine, a root cause approach. And as a dentistry, you don't hear that enough. That's so fascinating how all the things that you don't learn about, no one prepares you for being a dentist. Even I talked to someone today that's a hairstylist and working on coloring hair, how you're just surrounded chemicals, or people with mold toxicity that are in that moldy environment. And we don't correlate all these signs and symptoms together to figure out, oh, it's my environment I'm in, and
Yeah,
not
because
realize that.
you don't assume it, and you just accommodate. Something starts to change, your gut starts to have a problem. You think, oh, it's my food, or, my hand starts to get numb. Oh, it must be my dentistry. I need another massage. I mean, you just accommodate. You don't ever go, whoa, it's like what I'm around every day.
So, what are some signs and symptoms of mercury poisoning? You said a few things, but just could you list them together so we are more aware to
Yeah,
start?
so mercury affect gut function. So a lot of gut issues. It actually
Mm.
affects your stomach's ability to create stomach acid. It interferes with zinc absorption, and zinc is a precursor to stomach acid formation. So you get a lot of bloating, a lot of digestive just upset. You eat food and it just feels bad. You can tell your body's just not absorbing or digesting it properly. So that bloaty, upset, even stomach acidy, acid reflux kind of feeling where the food's just stuck because you don't get enough stomach acid. A lot of neurologic issues. So people will have things like brain fog, like, memory problems, as well as nerves. So hands, feet, those things, extremities, a lot of neuralgia is related to mercury. Mercury is a neurotoxin. So it's going to affect everything that involves the nervous system. So that's where a lot of the brain issues, the extremity function issues are going to show up from mercury poisoning.
And it's interesting how many people I know, to be honest, I've been trying to get my mercury taken out of fillings when you're a kid. Now, of course, no one gets them done that way, but just to find someone that gets them removed, but how they need to do it correctly, as you're a great example of what happens if you are on the other side of the mercury removal, how you are affecting your own health with mercury poisoning by removing it. So you're removing it and they're almost passing it on to you.
That's exactly what happened. Yeah, so it's really important. And I tell people all the time, and you said, no one's doing it that way anymore. Well, that's actually not true.
Oh,
Mercury fillings
really?
are placed in mouths all across the country. In a lot of European countries, it's been banned, but not in the US.
Of
So it's
course.
still placed in mouths across the country here, and it is 50% mercury. So if you're going to do it, the biggest release of mercury happens during that removal process. It also does happen day in and day out. Research shows now, and I can tell you this without losing my license now. Research shows that it is released from those fillings 24/7. Every single time you put your teeth together, every single time you have a hot, cold change, a hot drink and a cold, a cold bite of something else, it's going to release more mercury. So that mercury is released all the time. But during the removal process, that's when you get the most. So I tell people all the time, do not get them removed unless you're going to get them removed safely, because that's the most dangerous time is during that removal appointment. So there is a way to find a dentist that will do this with the safe protocol. So the organization that I found is called IAOMT. So the IAOMT.org, and we can put this in show notes for people, but IAOMT.org, they have a directory on their website of dentists who have been trained to do this with the protocol that I learned. I also have a directory on my site. So livingwellwithdrmichelle.com is where my directory is found. It's all free to you. We get about 50,000 people a month looking for dentists on our site because so many people have learned about these things and said, okay, if I'm going to do this, and this is just the tip of the iceberg, I actually have what I call the big three. So mercury or metals is one of them, but there's so many things that relate to health that are in the mouth, you need to find somebody who knows what they're doing. That's why I've worked so hard to create a directory too, so people can find someone close to them.
Hmm. And it's not covered by insurance, probably, correct?
It's depending. Sometimes it is. If it's just a filling replacement, you're taking an old filling out, you're replacing it with a white filling, that's absolutely covered by insurance. It's just normal dentistry. Even things like, removing an infected tooth that we'll probably talk about, coming up here, that's just normal dentistry. Removing a tooth, that's normal dentistry. And a lot of times dental implants are covered on dental insurance. So these aren't things that are necessarily outside of the scope of traditional dentistry and even insurance coverage. Now, not every dentist that does this kind of work is a provider on insurance plans. And that may be what, people find more often than not, is that the insurance does have some coverage for it, but the provider that they're seeking is not a provider on their plan. So it's out of network coverage, but they still will provide benefit for it. We have lots of patients come to us that we're not a provider for their plan, but their plan still will provide out of network coverage because it's just dentistry.
Yeah, you would think. I find that so many people have these random symptoms, and to figure it out, oh, it might be mercury. Oh, it might be mold. It might be something else. How are you finding educating people to know, oh, I need to look at mercury as an option to get those teeth removed?
Well, anytime you have an old silver filling, that means you have mercury in your mouth because any silver filling is 50% mercury. So that is always on the radar. If you look in your mouth and you see a black filling in there, you have mercury in
Obvious.
your body.
Yeah.
So that's an easy one. But some of the other things that I'm going to talk about, we find on something called a cone beam CT scan. So again, like I said, research, and not just dentist research, like MD research showing 60 to 80% of chronic disease is related to your mouth. So if you have a chronic disease problem happening, you need to go and have a screening with a dentist who knows what they're looking for. So we get what's called a cone beam CT scan. It's a dental specific scan, goes around your head, not the one you used to have when you went to orthodontist or had your wisdom teeth out. It's a little different, but what it does is it shows us everything in 3 dimensions. So I can see every tooth in your head in 3 dimensions. I can see your airway where you're breathing through, so I can find out issues with sleeping. I can find issues with any kind of swelling or inflammation that may be related to autoimmune disease. I can see all of that with the scan. So that really is essential in my mind, is go and have a scan done. If you feel like, gosh, my chronic disease is just not doing what I feel like it should do, I'm doing all the right things, most likely there's something hiding in your mouth that's influencing it.
Hmm. Speak to the two things you mentioned, root canals and infected teeth and getting the tooth removed.
Yeah, so this is a really interesting one. Root canals, the concept of them are awesome. If you have a tooth that has a deep cavity in it, or perhaps you hit it and it's broken or something and that nerve is exposed inside of the tooth, 100 years ago, the only option was take the tooth out. So dentists figured out they could clean the inside nerve channel, the root or the canal of the root. They could clean it out, disinfect it. We use actually bleach is what dentists use to disinfect the inside of the tooth, and then fill it up with something called gutta percha. It's kind of a rubbery material. And then you go on your way, right? You keep chewing with the tooth, smiling with the tooth. I mean, the concept is awesome. You keep your tooth. However, the problem is inside of a tooth, there's not just that main nerve channel. When you tap on your tooth like this, you can feel it. How come? Well, there's little feeder channels that go all the way through the tooth that have nerve tissue, that have blood vessel tissue. That's how nutrients get from inside of you all the way out to your tooth. Those little tiny feeder channels are too small to clean and too small to fill. So no matter what, no matter how well a root canal is done, you have dead tissue trapped in your tooth once it's done. Well, anytime you have dead tissue in your body, bacteria are going to find it. So now if bacteria start to congregate, your body's immune system has to jump into action. And that's the huge connection between these dental problems and autoimmune disease, or even things like cancer. Because when the body is distracted 24/7 by a low-grade chronic infection like this, dead tissue attracting bugs in your mouth, your immune system is not able to take care of you the way it should elsewhere because it's just distracted, it's worn out, it's tired. So we see a lot of autoimmune conditions related to these low-grade infections. But here's the problem. You can't feel them because the nerve's gone. So your early warning system that you relied on for the first toothache, where it's like, oh, it hurts, it doesn't hurt anymore. So people will say things sometimes to me like, it just doesn't feel right. You know, they just kind of tap on it. I don't know. I mean, it just doesn't feel right. Those are the things they tell me, but they don't usually say it hurts. That's where we find that cone beam CT scan is absolutely necessary, because I can see on there what's really going on. And the tricky part is the regular dental x-ray, you know, the kind where you put in your mouth and you take it, that kind, it actually doesn't show these. So I'll always remember this patient. This was probably one that really changed my mind about these root canals. She came in and was doing exactly that. This tooth, I don't know, ever since I had a root canal, it just doesn't feel right. So we took a regular dental x-ray. I looked at the x-ray and I said, it looks just fine. In fact, if you had shown it to 10 dentists, they would have all said, it looks just fine. But I had just gotten my first cone beam CT machine. So I said, you know what? Let's go get a scan. Let's just go see what it looks like. So we took a scan. It popped up on the screen and I could not believe what I was looking at. She had a quarter-size hole eaten in her jawbone above that root canal tooth, and we could not see it. I could not see it on the regular dental x-ray. It's not visible. So all of these root canals, and there's 25 million of them done per year in the United States alone, all of these root canals look just fine on a regular dental x-ray. So you say, well, I have this autoimmune condition. I have, arthritis, or I have Hashimoto's, or I've had cancer, whatever it might be. Maybe something's going on in my mouth. So you go to your dentist. They take a dental x-ray, regular dental x-ray. They say they're just fine. You've got to have the cone beam CT scan, because I can see the bone. I see exactly what's going on and what's happening. And on a daily basis, I find holes and infections and bacteria and destruction. I mean, things like someone has a sinus infection, has had 3 sinus surgeries. The ENT has said, I don't know what else to do for you. Like, I don't know why it keeps getting infected. So finally they go, well, maybe, I don't know. I've heard maybe dentists have something to do with this. So we take a cone beam CT scan. We find an upper molar that has an infected root canal, and it's literally eaten a hole through the bottom of the sinus and is completely filling the sinus with infection. So the ENT comes in, clears it all out, goes their own happy way, and the tooth then goes right back up again. And the person cannot figure out why they have chronic sinus infections even after sinus surgery. It's because it's not the sinus that's the problem. It's the tooth that's below it, sitting right at the base of that sinus, that's filling the sinus with infection. These root canals are so, and they're really silent. You don't know what's going on. So if you have root canals in your mouth, go get a cone beam CT scan, see what's happening.
I've had that done with a natural dentist I was seeing in Solana Beach, and they stopped covering insurance. I had to go somewhere else. It was disgusting. It's really scary to look at your teeth, and I've never had good teeth. I just think it's part of it's genetic. You just inherit bad teeth. I don't know what do you think on that, but it is pretty powerful to see that.
It is. When people tell me that, oh, it's just genetic, I always encourage you to take a next step. What's genetic?
Mhm.
So
Yeah.
cavities are not just because you didn't brush your teeth right. In fact, in your situation, I'm guessing it's not that at all. Because I see people just like you who are really conscious about their health. They do a great job. And I can tell as a dentist, so I can tell looking at your mouth that you brush and floss, you take care of your teeth. And yet I look in your mouth and you have 15 fillings or crowns or whatever it might be. And I
Mhm.
just look at it. I look at somebody like you and I say, you've had tooth problems your whole life, haven't you? And usually people start to cry about that point. We're like, yes, this is every single time. And my brother would go in and he didn't even own a toothbrush and he had no cavities. And every time I go, I had 5. It's not fair. So then we always back it up and say, okay, so what's genetic there? Most likely it's a gut function. It's not that you didn't brush, it's that you aren't getting the nutrients necessary to keep your teeth healthy. So your body, it has to have minerals to run your brain, to run your heart, to run essential functions. So if it's not getting enough because your gut is not absorbing properly, then it will go and mine them out of your teeth and out of your bones to take care of those essential properties. Because you can live without teeth. You can live without bones. You can live with, that's what's called osteoporosis. It's your body, robbing Peter to pay Paul, basically, because it has to have your heartbeat and it has to have your brain fire, but you don't have to have teeth. So if I see someone like you who takes good care of their teeth and they continue having cavities, this is a gut function issue. You're not absorbing. So we start doing minerals. I do minerals on the outside and minerals on the inside. So I say minerals out, minerals in. So minerals on the outside, this is where we get into the fluoride controversy. You know,
Mhm.
there's a lot of talk. In fact, Utah, where I live, was just the first state that banned water fluoridation, which I was so excited about. And people are freaking out in my state. And there's the American Dental Association is coming and saying, all of you dentists band together and, fight this. And I'm saying, what are you talking about? This is not something I want to fight. Cavities are not a deficiency of fluoride. They're not. They're not a deficiency of fluoride. Fluoride does all sorts of other problems in the body, including affects IQ levels and thyroid function and bone density and on and on and on. Cavities are a deficiency of minerals. So if you're getting cavities, you are not getting enough minerals. So we need to put minerals on the outside, which is hydroxyapatite. That is the mineral that your teeth are made of. And this has kind of been a buzzword people are talking about in the dental circles and wellness circles now, is this hydroxyapatite. What the heck is that? Well, it's just the mineral complex that your teeth are made of. So when you smile, you're looking at hydroxyapatite. That's what that is. The enamel is made of hydroxyapatite. So cavities are when that hydroxyapatite gets pulled out of the tooth and leaves a hole. So what do?
Mm.
You can heal cavities by putting that mineral back in. So minerals on the outside is hydroxyapatite. I have a tooth powder, I have a mouthwash, there's toothpaste, there's all kinds of products nowadays, and then minerals on the inside. So that is, first of all, a mineral complex. I have what's called tooth bone formula, but it's minerals. It's a mineral complex along with vitamin D3 and K2. A lot of people don't realize this, but minerals on their own don't get absorbed, actually. You have to have vitamin D3 to grab them and vitamin K2 to put them in the cell. So a lot of times there's a lot of diets that don't have a lot of vitamin D3. Vitamin D3 largely comes from the sun anyway, and we're all sitting inside all day long. So we don't get enough vitamin D3, but vitamin K2 is particularly, it's difficult to get as well. So many people are mineral deficient today. So getting cavities, having osteoporosis, having other issues like that and not realizing you just are going to have to add some extra D3, K2, and the minerals.
So I always like to go deep and work understanding the mechanism of action, the order of operations. So you're saying teeth problems leading to mercury fillings, root canals, tooth removal is coming back from what we're eating, but not, I would say it's not what we're eating, but how we're digesting it and breaking it down. And
It
so
may
if
be
we
what we're
have,
eating too. If you're eating just potato chips and donuts all day long, you're going to be
yeah,
deficient in minerals also.
yeah. So
Yes.
I just mean like I always think about what we eat, but it's also how we break it down, when we eat,
Yep.
why, where. But the what and how is an important part of our dental health. And so if we don't get the minerals from the food, good food from nature that we are eating, proper digestion, that food's not broken down properly. Is it going down to our stomach? So we have poor stomach acid. If it's low stomach acid, or high stomach acid, H. pylori, how that impacts our stomach absorption of breaking down these nutrients and getting the minerals from the food, as you said, zinc. And then how we go from the stomach organ down into the small intestine and nutrient absorption. Part of that's maybe not getting digestive enzymes. So can you kind of fix that, clean that up for me? Is that what am I thinking the right mechanism of action of why we have tooth problems if we don't eat crap?
Exactly right. Exactly right. If you brush your teeth and you don't eat, and you eat well, but you still have tooth problems, because I get people that are along this way all the time. It's interesting. So even to go back a little further, in the 1930s, there was a meeting of a bunch of dental researchers, and they all said, we want to decide once and for all what causes cavities. So three people brought their research to the table. One was something called the acidogenic theory, which said you eat acid, or bacteria eat sugar and create acid, and it dissolves minerals. The second one was Dr. Weston Price, who a lot of people inside of the health world know, inside of the nutrition world know. He was a dentist. Not everybody knows that he was a dentist, but he found that you literally can have cavity-proof teeth based on your diet. not only cavity-proof teeth, but big, nice, wide smiles, open airways, plenty of room to breathe, very good reproductive function. I mean, all kinds of things based on the diet, the things you were eating. The third one, Dr. Melvin Page presented his findings. They were about hormones, and that hormone fluctuations actually change the way that the body utilizes nutrients and minerals as well. So they all voted at this meeting and said, well, let's vote which one is more likely to be true, or, the one that we want to perpetuate. So what did we know? What did our mom? That if you eat sugar, you're going to get cavities, right?
Mm-hmm.
If you don't brush your teeth, you're going to get cavities. So
Right.
the first theory was the one that was voted on and chosen, the acidogenic theory, that acid on your teeth or bacteria eating sugar creating acid on your teeth will dissolve the teeth, dissolve the minerals, and create cavities. The other two were just discounted. We're kind of forgotten. The idea that nutrition affects teeth and that hormone fluctuations affect teeth. So when we talk about nutrition, it's absolutely the food you're eating for sure. But Dr. Weston Price found even in the 1930s that the food at that day that had, been the modern standard American diet wasn't as nutrient rich as the food of indigenous societies. So we know that the food today probably doesn't give us as much as it once did. So that's the first kind of problem, is that the food itself doesn't have as much in it as it did at one point, unless you're growing it in your own garden in your backyard, which not a lot of people do. So once you do eat it, yes, you need saliva. Saliva starts to break down the food, then it hits stomach. And so many people are deficient in stomach acid today. A lot of the symptoms of that are bloating, indigestion. You feel acidy, like, oh gosh, burning in my throat. You just don't feel good after eating. And most people assume that's high acid levels. I have too much stomach acid. So you go to the doctor and they give you an acid reducing medication. The problem is it's usually too little stomach acid. The food sits there, it ferments rather than breaks apart and digests, and it actually pushes bubbles up when we get that acidic feeling. So I have a really easy test that people can do at home to determine, is this too little or too much stomach acid? So it's called the baking soda test. You've probably heard of it before. Super easy, but I'll tell it to you if it's okay, just because people may not have heard of this one. So you take a quarter teaspoon of baking soda, half a cup of water, and you drink it. Then you time how long it takes you to burp. And people always say, well, what in the world does that have anything to do with this? Well, because that baking soda should cause a chemical reaction with your stomach acid. So you should be burping in 2 to 3 minutes. If you're not burping in 2 to 3 minutes, it means you do not have enough stomach acid. If you're burping in 2 to 3 minutes, plenty. If you're fine, you're good to go. So that's the test I tell people to do first. Just see if the food is even making it past the stomach. Because what the stomach, that acid does is it does a few things, but for minerals in particular, it ionizes the minerals. It makes them absorbable. So then exactly like you're saying. So if you do not have enough stomach acid, I tell people go and start supplementing with stomach acid. It's called betaine. It's derived from beets largely. You start taking that along with your food temporarily while you figure out why you're not creating enough stomach acid. And I have all sorts of information online if anybody's interested for free. Go on, do some assessments on there on livingwellwithdrmichelle.com. But once it makes it past that stomach level and it's ionized properly, that's where the vitamin D3 and vitamin K2 come in. That's where you absolutely have to have the correct absorption to be able to get it into the cells. So if you're eating enough minerals, but you don't have enough vitamins, what you end up with is gallstones, kidney stones, tartar on your teeth, tonsil stones, basically minerals in areas that you don't want them because you don't have the ability to put them in places that you do want them, which is your teeth. So if you're getting stones everywhere and you're getting cavities in your teeth, you are not absorbing minerals properly. You've got to deal with those two places. Stomach acid, do you have enough? And do you have enough vitamins to actually get them to where they belong in the cells?
That sounds a lot of what we covered in my nutritional therapy practitioner program
I
because
love that.
we had to read books back then, and we had to read why is your what the stomach acid, why it's not about stomach acid, or what's that book called? Something about stomach acid. Then we had to read Weston A. Price, his book, and study all that in the Pottinger study. And it's so
Yep.
fascinating how, the baking soda challenge is something easy to do, pretty much almost free,
Yep.
Trader Joe's and buy for $2. And I posted that recently, a few months ago. I did a video on it and how it is something we should all do because lab testing costs a lot. I do functional lab testing as a practitioner. looking if you have H. pylori and looking at a stool test to find out more. But a lot of it is just doing some free things we can do, as well as I find a lot more people need to strengthen their vagus nerve and get more parasympathetic function before they start thinking about what they're going to eat. And
Yep.
do you have any findings with that in the parasympathetic state? So many people are in a stress state and in that sympathetic dominance mode.
100%. There's actually a lot to do with dentistry in that regard too, because all of the infections that we're finding, these hidden infections, push people into that fight or flight mode. And a big one that relates to that is airway insufficiency. So
Hmm.
that's the third of the big three that I was talking about, that most people don't think of the dentist to going, to go see, but 60 to 80% of people in our world today are actually struggling with sleep quality. They aren't
Mhm.
going to sleep, they aren't staying asleep, or they aren't getting restful sleep. So even if they feel like they slept, they wake up in the morning and they're like, why do I feel like trash? And I'm ready to just hit the bed, hit my bed by 2 p.m. in the afternoon, and what's going on? A large part of this actually goes back to Weston Price again. What he was finding is that with the standard American diet, mouths form smaller. And we know
Mhm.
this to be true because how many of us have had crooked teeth and had braces, or still have, teeth that don't all fit in their mouth? How many people had wisdom teeth removed? If you look back 200 years ago at skulls, everybody had straight teeth and they had all 32 teeth in their mouth. That includes the wisdom. So what happened? Well, interestingly enough, the top jaw is the first bone affected by malnutrition. So when you get malnutrition, the reason I really know this is because I adopted a little boy at 2.5, and he was very malnourished. His mouth was so small, his baby teeth were literally all of them on the inside of his bottom teeth, his top teeth. They were lined up like airplane on a runway. It was absolutely crazy. And I learned that top jaw is the first bone affected by malnutrition. So when it is too small, the bottom jaw has to become too small, has to go backwards. So we end up with crooked teeth. They don't all fit, and there's no room for wisdom teeth. We should have for all of our teeth. So if there's no room for teeth, there's also no room for tongues. There's no room for tonsils. This is why we have so many swollen tonsils, because you have to hang your mouth open to get more air. So you end up mouth breathing. The nose is narrow because the bottom of the nose is actually the same bone as the top of the mouth. So you have a real skinny nose. So we're really excited about our super small noses, but nobody can breathe. So nobody can sleep. And so all of this forces the body into fight or flight mode. Again, this is all about low stomach acid, that's parasympathetic versus sympathetic, so when you're in that sympathetic mode, because you literally are suffocating at night. So what do? You go to the doctor and they put a forced air on your face, which is called a CPAP. It fixes nothing. It fixes nothing about the actual volume or space or ability for air to get in. It just forces more air in, which then turns off your brain's own communication mechanisms to tell you to breathe. So it actually makes the problem even worse. So what do you do instead? So if somebody has chronic low stomach acid, vagal nerve, just the chronically in the sympathetic fight or flight state, see, how are you sleeping? Let's do a sleep study. Let's actually find out what's going on. We find out you are waking up 10 times a night, or you are never dropping down into deep sleep, because what happens, go into deep sleep mode, all the muscles holding your airway relax, because the definition of REM sleep, that deepest level, is paralysis. Like you have to paralyze. So no muscles work in the deepest sleep level. So all of these muscles holding the airway collapse, including the tongue falls backward. All of these muscles collapse. So if you can't actually breathe when that happens, you can never be in that deepest sleep mode. So you end up clenching your teeth, or squeezing your teeth, or grinding your teeth, or bringing your bottom jaw forward like this, which wears out your front teeth. People will say, why are your front teeth wearing out? Because you're not breathing. Or you get extra bumps of bone underneath your tongue and here. People think that that's normal. That's not normal. That's all due to you squeezing, clenching, tightening. If you wake up with headaches or sore muscles, oh, everything's tight, sore shoulders, it's because you are working to keep yourself alive at nighttime. So what do? We actually just make your mouth bigger. We do expansion, and we make more space in your mouth for your teeth and your tongue and your tonsils and all the tissue, so that you can sleep and breathe at the same time. So many people
How do
can't
you,
sleep and breathe at the same time.
yeah, crazy. How do you do that though? How do you make your mouth bigger?
So we do it with expansion appliances. Sometimes it's as easy as appliances like Invisalign.
Hmm.
So we're just tipping teeth out. We're just making more space in here for things. If it's really severe, really tight, we do have some other movable appliances that go in that actually have springs and screws and, help to move things out. But it's kind of like what they do if you're 11 and you have a little, really small mouth. They do an expander. We do the same for an adult. We just make more space in the mouth. And always remember this gentleman. He was a farmer, but he had to drive truck a lot. He had to drive truck. He had to drive his cows different places. He had to drive his hay different places. And he was always on the road. He had a busy company. He was a really, really a successful man. And he was in tears in my office. And his wife was with him. And she said, he does not sleep at all. And he is terrified that he is going to crash and kill himself on the road because he's so exhausted all the time. So we looked, he had a teeny tiny squished mouth, squished nose, couldn't breathe at all. He tried a CPAP, it didn't work. So we started doing some expansion for him. But his wife called just in a panic, and he'd come from a couple of states away. His wife called in the panic, and she said he nearly crashed yesterday. He fell asleep. He stopped on the side of the road. He doesn't dare ever drive again. What can you do? So we have a few other things we actually can add on to that too, because it takes a little while to make that difference. We have lasers that actually shrink up the tissue at the back of the throat. So sometimes we just have to get some stuff up and out of the way. We can shrink tonsils. It's called night lays. So if anybody's, in a different state wants to know, it's called night lays. It can shrink tissue at the back of the throat. It can shrink tonsils. It can shrink things and get them out of the way. We also sometimes do an appliance that actually holds your jaw forward temporarily. I don't like to use those long term, but temporarily the airway to get enough sleep at night while we're working to make more space as well. So we see the sickest of the sick and the people who are really desperate to get well. And there are answers, even for you, if that's where you are, because every single, little bit of air that you can get is going to increase your health, is going to increase your body's ability to keep yourself well. It's going to decrease that fight or flight. It's going to increase your performance, all of the above, because oxygen literally powers up every single cell in your body. Without it, you simply can't be well.
Goes to two things, probably all maybe related: cellular health and nitric oxide in the mitochondria.
Yep.
Are those involved in, I'm sure, mitochondria everywhere, but are red blood cells? So is there any connection there in dental work and health and longevity with nitric oxide for one, and talking anything to do with the mitochondria function?
Yes. So nitric oxide is largely formed when we nose breathe. So there was a really seminal book called Breath by James Nestor. A lot of people have read it. And he
Mm-hmm.
did an experiment where he plugged his nose for, I can't remember, it was 21 days or something. And he basically glued his nose shut. And he could not believe how significantly his health deteriorated during that time. And the huge piece about this is that when you're breathing through your nose, it actually creates or generates nitric oxide. So when you're mouth breathing, which if you don't have enough room to get air in, that's just the body's default. You have to open your mouth wide to be able to do this. So nitric oxide doesn't get formed. This is really impactful for children too, because it also creates growth hormone. So in us as well as adults also, because growth hormone isn't just for growing children, it's for regenerating. And so if you're not breathing through your nose, you're not getting nitric oxide formation, you're not getting growth hormone formation, and the nitric oxide is largely for vasodilation. It's for expanding those blood vessels so that things can go deeper, so you can get the oxygen into the lungs, into the brain, into those areas. So if you're not breathing through the nose, you aren't getting those effects. So a lot of people, they're doing mouth taping, right? This is a big trend that you've probably seen.
Mm-hmm.
The idea is awesome. Keep your lips together. In fact, my husband mouth tapes every single night, and it really does help because it forces the nose breathing. The body should breathe through the nose automatically, but a lot of us, from development reasons, aren't able to do that. So mouth taping does help, but then I encourage you to continue taking steps to make the mouth bigger so that you don't always just have to tape the mouth shut. So like you'd said, in mitochondria, that's what burns oxygen. And in my new book, it's all about cellular health. And I lay out how when your body uses a molecule of fuel, it actually loves glucose. That's what most of our cells use to create energy. They use ketones as well. Ketones and glucose are the two things that they use. If you have a molecule of fuel and no oxygen, you're going to run at 2 miles an hour. Basically, you're going to create two batteries. But if you have that same molecule of fuel and oxygen, you're going to create 34 batteries. So I equate this to you run 2 miles an hour without oxygen, 34 miles an hour with oxygen. Oxygen literally powers you up. If you're not getting it, you simply cannot have the energy that you need or want to be able to be healthy and well.
I do Pinoe metabolism testing, which is measuring your breath basically at rest and during exercise. So how well do you breathe at rest, doing nothing, lying on your back? So it'd be interesting to start thinking when I'm analyzing people's data of dental work, if add that into the health history form of, do you have problems sleeping at night? Do you have any dental work
Yep.
problems? That'd be good correlation with the breath analysis
And
part
I
of
would
it.
add, do you have crooked teeth? Or did you have
Mhm.
braces? Did you have teeth taken out for braces? Because so many, I call it the Ambien generation. It's kind of my mom's generation. They all had teeth taken out for braces. Well,
Mm.
when you have teeth removed for braces, it's the easy way out, first of all, because it's really easy to straighten teeth if there's fewer of them. So it's the easy way out. But when you take teeth out, what you make is the mouth permanently smaller. So now there's no space for the tongue, for the teeth. So I see an entire generation of people who are now on Ambien because that's the only way they can survive, which Ambien is a little bit of a farce because you feel like you're asleep. Your brain's telling you you're asleep, but it's not improved your sleeping function whatsoever. So you're not getting the oxygen. You're not getting into restful sleep. You're not regenerating. You're not doing any of those things. You just aren't going insane because you're laying there with your eyes open all night long. But all of these things would be really great questions on your questionnaire. Did you have braces? Did you have your wisdom teeth out? We didn't even talk about that. That's a whole other area where hidden infection or when infection hides is actually where wisdom teeth were removed.
So with looking at hidden infections, so as a health root cause practitioner investigator, we're more FDN practitioners, we investigate what's actually going on under the hood at hidden sources of chronic stress. And looking at that in the mouth with infections, the dental health is, you're saying how much that's correlated to gut health and brain health, and how infection, as you just mentioned, the root canal, wisdom teeth. I know I had to have a tooth pulled out, one cracked molar or something. And I'm, thinking all these infections, because now you have holes in your mouth that you can get bacteria infections that they're not always discovered. And I don't know if there's lab testing to find bacteria infections in your mouth or how you test that. So,
So there's
hidden
three hidden
stressors.
infections. Yeah. So one of them is gum disease, and that one thankfully can be detected at the dental office quite easily.
Mhm.
So we use a measuring tool there just in the dental office, and we measure the gums, and we can
Mhm.
determine what's going on. So thankfully, that one's easy to find. The second one is the root canals that we already discussed. The
Mhm.
third is areas in the jawbone where a tooth was removed, and the anatomy is also comes into play for this one. There's a ligament surrounding every tooth. That ligament doesn't come out with a tooth naturally. It has to be removed kind of intentionally. You have to remove it. And oftentimes, especially with root or with wisdom teeth, you don't really want to go poking around. It's down by nerves on the bottom ones, and it's up by sinuses on the top ones. And, so the ligament gets left behind. Well, for about 10 days, the body doesn't know that the tooth is gone yet because the ligament's still there. It's kind of like the placenta and the baby. The ligament's still there. After 10 days, the body figures it out. It's like, oh, there's a dead thing in here. But during that 10 days time, the gums grow down into the hole and that ligament just kind of turns into this dead ball. It just necrosis. So by the time the body figures out the tooth's gone, there's this dead hole in the jawbone with gums grown over it that the bone does not grow into. So that's the problem, is this dead zone in the jawbone. How do you detect it? Well, it's found on the cone beam CT scan. That's where we find those. And we find so many of these. And the interesting thing is when you talk about sympathetic, parasympathetic, all of those kinds of issues, there's something else with the mouth that I think is fascinating. It's called tooth meridians. So this goes back to acupressure and acupuncture, clear back in Chinese time.
Yeah.
And there are every single organ system is represented in the body in four places: in our hands, in our feet, and our ears, and in our teeth. Those are the four places. And if you think about it, it powers up every organ because how much do we use our hands and our feet and our teeth? The ears I haven't quite figured out yet, but I'm sure there's a lot going on there too. Air rushing
Yeah.
by.
Yeah.
So the teeth are connected to every single organ system, and they can create a short in the system. So the system that's connected to the wisdom teeth is the endocrine system. And I cannot tell you the number of people that come that have adrenal fatigue. They just brain fog,
Mhm.
just cannot get up, get up and go that they want, and they have done everything right, and they still can't get there. I remember this lady, she had to move home. She was in her 30s. She'd had to quit this job she loved so much. She was bedridden. We found infections in those wisdom tooth areas. Cleaned them out. That's what we do. We clean them out, disinfect them, fill them up with stem cells. The next morning, she was up doing dishes. Her mom said, "What are you doing?" And she's like, "I feel better than I felt in a decade." I cannot believe how much this was impacting my overall ability to be well and just energy levels, everything. So you can get those in wisdom tooth areas. And a lot of times we'll equate things. It's so fascinating because no one thinks about this, but they'll say things like, I have been tired ever since like my freshman year in college. I thought it was just college, but I just can't get past it. And I'll say, "Well, when did you get your wisdom teeth out?" "My freshman year in college." "Oh, interesting." Or "I have not slept. I've had insomnia since I was like 17. "When did you get your wisdom teeth out?" "When I was 17. Interesting. So we go and we look for these hidden infections, and they're not always infections. Sometimes all they are is just a dead zone that's leading to inflammation in the body. But inflammation is the precursor to all disease. It's the body's basically its own defenses overacting and leading to damage everywhere. So we have to identify these hidden infections in the mouth and determine, is this is this the missing piece? And I never tell somebody that like their wisdom teeth removals led to their arthritis or led to their cancer or led to their high blood pressure. But what it does do is it impacts the body so much that the body can't do its own job of keeping itself well. Our bodies are incredible. They know how to be well. But if there's so much impacting that ability, it can't do its own job. So it's our job to figure out, okay, what's standing in the way of our cells doing their job? And dentistry has so many missing pieces that people are often not even knowing about.
That's so true. Now, could you explain again the infections, how that can contribute to or lead to autoimmune disease, which is your body attacking itself? Could you explain that a little deeper level?
Yep. So anytime you have an infection anywhere in your body's immune system, so let's say you have a sliver in your finger, your body's going to send the immune system there, right? That's why it gets red. That's why it gets swollen. That's why it gets tender. That's your body's own reaction to whatever's happening in that area. So anytime you have a chronic low-grade infection in the mouth or anywhere in the body, your body's immune system has to go and deal with it. Now, if you have a sliver in your finger, it's going to swell up, it's going to get sore, and then you're going to work and you're going to get the sliver out. Then the body's immune system can back off and its repair system comes in and fixes what was damaged. Well, what if the sliver never goes away? That's the problem with the root canals and the infections in the
Mm.
jawbone. The sliver never goes away. So the immune system is chronically on 24/7, never gets a day off, never gets a break. So now when something else happens in the body, it doesn't have the same strength or ability, or sometimes it's just confused. There's too many things to fight. And so now it starts to fight what we call autoimmune disease. It's attacking itself indiscriminately, often because there's just too many things to attack and it's just not able to keep track of everything anymore. So it's more about immune system dysregulation than cause and effect, if that makes sense. It's
Mm-hmm.
it's dysregulating the immune system so then it can't deal with other things. And there is research showing things like there's one researcher that shows that, well, in fact, I can even just speak from my own experience here. I have yet to see a patient with cancer or has had cancer that doesn't have an infection in their mouth. I haven't found one. Haven't found one. And oftentimes the infection is on the meridian that they have cancer in. So I'll find a root canal right here, infected root canal right here, and that's the breast cancer meridian, and it's on the exact same side as the breast that had the cancer. or a lower molar and its large intestine, and they had colon cancer. So did it cause it? No, I'll never say it caused it. But what it does is creates a short in the system, which makes your body less capable of caring for itself.
So the meridians, I've seen that chart, by the way, and I'll try to put that in the
Yeah.
show notes because I saw it and I looked at my history of adrenal exhaustion, whatever you want to call it, and how those were connected. It's like, that is insane. And I
Yep.
took a photocopy of for the holistic dentist office here in Solana Beach, and I have that saved in one of my files somewhere. And I just did a podcast with a lady talking about emotions in the meridians and not being able to heal from trauma or letting go, stress of, not finding your purpose and your why. Anyway, so looking at all these relationships to the word meridians, are they with the teeth meridians? Are they related to organ functions? If so, you're saying they're dysfunctional, or the connection, the wiring system isn't as strong? Or how do you teach
Exactly.
people in Chinese medicine the way of think of that and for people that aren't
Exactly. And
doing it?
yeah, because
Sorry.
anytime I start talking about energy, people start rolling their eyes. They're like, oh, she's one of those crazy people. But that's when I always point back to, okay, let's say you've got an Apple Watch on and it's recording your heartbeat. What is it measuring? It's measuring the electricity in your body,
Mhm.
right? That's what your
Mhm.
Apple Watch is measuring. That's what it's measuring. When you hook it up to a heart monitor and it go beep, 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 what is it measuring? The activity of yeah, it's the electrical activity in the heart.
Mhm.
So the body is wired top to bottom. And when that electricity stops and we hear the beep, it means we're
Mhm.
dead, right? So our
Mhm.
bodies are electric. I call it bioelectricity. Our bodies are electric when we say somebody is brain dead. What does that mean? It means the electricity in their brain has stopped. So our body is electrical top to bottom, and we have a wiring system. It fits right on top of the fascia in the body. So there's muscles, fascia, and right on top of that is this electrical wiring system. So it goes everywhere. Now I liken it to a room. So right now, the room I'm in, when I flip on a switch, it's turning on that light, it's turning on this outlet over here. What if I cut the line in between the switch and the light? Is it going to affect the outlet too? It does. And we call these short circuits, right? And we use this
Mhm.
language, but we don't think of our bodies in this way. But
Yeah.
yet we do because we say things like, I'm so drained. I have no, drained means our energy's gone. Like what's draining us? I have no energy. I'm just, we use these words, we don't think of it in electrical terms. So
Mhm.
these meridians, if you have an infection on that line, it will affect everything else on that line. So we will also see it in reverse. If you have an issue, let's say in your kidneys, I will actually find sometimes a problem in a tooth that's on the kidney meridian. So it will go both directions. One of my favorite stories is a gentleman that I walked in and saw him as a new patient and he was orange. Like that was the first thought in my mind is this man looks orange. So I didn't say anything at the beginning, but eventually I just said, I'm sorry, but I just have to ask, you look very orange. And he said, everybody asks me if I use self-tan or cream, and I don't. Well, we took a CT scan, and what I found is that he'd had an accident when he was 11 years old, had hit his front teeth, and had root canals across all of them. Guess what the liver meridian is? These teeth right here. He literally was jaundiced and had been since he'd had those root canals at age 11. And everyone had just said, you look yellow. But no one had ever been able to point to why was his liver not functioning properly because of these teeth. It had short-circuited the liver. So was the liver dead? No. I mean, his liver was still working, but it was jaundice, meaning it wasn't able to clear toxins from his system efficiently because it was draining energy, literal energy was draining out of these root canals. It was shorting that circuit.
So would the solution be to do a liver detox support with the nutrients for phase 1 and 2 on that drainage
So
pathways, or how would you fix the tooth first or the organ, support the organ?
exactly. Well, I'm a dentist, so obviously I'm going to tell you to fix the tooth first, but we get patients from all over the world that come from their doctors saying the exact same thing, that I can't
Hmm.
fix your liver until the source of the short is
Ah,
gone.
makes sense.
It's in essence kind of wasting time and money and energy
Yeah, you're
trying to
not
fix
treating it.
this
Yeah.
when the short circuit is still there. Well, what do we do? And that's what everybody always asks. Well, what do you do? We actually remove the teeth. And that's like devastating to people. But I used to tell people, I will save your teeth at any cost. And that's what we're taught as dentists. Like we are taught, save a tooth at any cost. And now I say, I will save your health at any cost, even if it means removing and replacing a tooth, because I can replace your teeth. I can replace them with ceramic dental implants all day long, but I can't replace your health. So we do remove and replace teeth. We use stem cells, we use ozone, and we replace them with ceramic, or another word you may have heard is called zirconia dental implants, where it replaces the tooth and it restores that meridian and the problem goes away.
Okay, so that makes sense. So if you're struggling getting results with the protocol you're doing, as doing a liver detox over and over again, it's still not fixing the problem. But connecting the teeth, the meridians, would be super fascinating to look at more of a root cause approach
Yep.
and
And you can
order
look
of
up the meridian
operations.
chart online. Just look up
Yeah.
tooth meridian chart. It'll pop up and you're going to just see every organ system. You're going to see which tooth. Don't just look at root canals though. I want you to look at dark teeth.
Mm.
Sometimes teeth that were moved during orthodontic treatment, so during braces, will actually die and you don't know it, but you'll just have a real dark tooth and it doesn't hurt, never had a root canal. That also can be a short on the line. And that the reason I say that is because these teeth right here are the ones that are most frequently not, had to be brought in with braces, and they are on the liver meridian. So liver, kidneys right here is the front area. So sometimes we'll see dysfunction in that way. You'll get toxic buildup, you'll have other things. You'll have done everything right with the liver, but then we find this dead tooth that was brought down from the roof of your mouth during braces. It killed it. It's dead. It's shorting the circuit.
Okay, so then there must be a whole domino effect of health issues that are related to working north to south. If you have dental problems and infections, all this other stuff can happen. You're relating, as you said, autoimmune issues. But if people have mold toxicity, they're more susceptible to mold because they're inhaling it. That would be related to their mouth, right? Because you said the bones are connected to the nasal bone, to the mouth teeth bones.
100%. 100%. And it's your body's less capable of dealing with mold exposure if it's dealing, it's all,
Yeah,
I like to think of health as a balance. It's all in a balance. And so how much have you put on the disease
teeter
side versus how
totter.
much have you put on the health side?
Yeah.
Are you able to tip it over? Because I'll tell people all the time, listen, your dentistry is not the only issue here. There may be a
Mhm.
mold problem. There may be a genetic, thing that leads to poor absorption and whatever it might be. But if we can just tip enough in
Yeah.
the other direction, then your body's capable of caring for itself. Your body's
Wow.
able to live in today's
Yeah.
world if we can just take enough off of its plate. And dentistry
Yep.
is often the thing that's enough.
Hmm. One more thing, I know we're going to run out of time, but just as you mentioned, getting teeth removed, and I hear about the dental implants, and to me, it always freaks me out thinking I'm going to get some metal post implanted, and it has to sit there for 6 months, and then you get the tooth, and you have to do a bone graft and all this stuff. So obviously, I need to do that myself, but I'm avoiding it. And just freaks me out, and it doesn't seem safe. So you mentioned getting the porcelain, or there's more natural,
Zirconia.
toxic-free type of options out there for people who are similar in my position.
Yep. Yep. Yeah, there's a lot of issues actually with titanium dental implants. They're the gold standard. I mean, it's what's been used for 30, 40 years. But
Doesn't
the
make it
interest
right.
Exactly right. And the interesting thing about it is that it's not necessarily an allergy, it's an overload because titanium is everywhere in our world today. It's in cosmetics, it's in sunscreen. It's what makes up the hard candy coating on the outside of Skittles and M&Ms. That's titanium oxide. Exactly. It's in paints, it's in bags, like it's in everything. And so I have so many patients who have an overload to the metal. I have one lady who, as soon as she had a metal implant placed, she couldn't wear a necklace anymore, couldn't wear it, couldn't let metal touch her because it was just too much. We took out the metal implant. She could wear necklaces, no problem. So it was just an overload issue. But the other issue that's really up and coming and is a big issue, and they're finding it in the orthopedic world because there's more knees and hips and shoulders that are metal than even
Mhm.
teeth. But the finding is in today's world, we are surrounded by frequencies. So we call it Wi-Fi, 4G, 5G. They're just waves that go through the air. Well, just like a microwave, you can't put a metal pan in the microwave because those waves passing through the metal heat the metal molecules up, and that they make them vibrate and it heats up. They're finding the same thing with metal parts in the body because of 4G, 5G, Wi-Fi. It's heating them up. 4 to 5 degrees, and that is literally melting the bone around it. So in dentistry, we're seeing a huge failure of metal dental implants, and they're blaming it on people. They're saying, well, they just didn't brush good enough. They just didn't floss good enough, whatever it is. And I'm saying, no, it's because we have 5G everywhere, and it's heating up and frying all the bone, holding our dental implants underneath.
Oh.
So now we place ceramic dental implants or zirconia. Like I said, it's the same thing, non-conductive, non-metallic. They don't heat up, and the body loves them. The gums attach to them, the bone attaches to them. That's what I would do. I actually have a dental implant here, and it is titanium because it's been here for 35 years. But I certainly don't put my phone on that side of my head. I am so careful, and I get a little sore in my nose occasionally. I'm like, oh, that dang implant. So I know that this is a real thing because I live with it on a daily basis. So if I were to get an implant today, it would 100% be ceramic. It wasn't an option when I got mine, but that's what we do in our office.
All right. So last we finished up on some recommendations, as you mentioned, minerals, you mentioned stem cells, and you mentioned laser, but red light therapy. Any of those things are solutions for people to be healthier in their dental health and healing?
Yep, for sure. The hydroxyapatite is the key. So that's the minerals on the outside and also vitamin D3, K2 on the inside. And I tell people, you know what? You're capable of never having a cavity again. And that is my goal, is to never have a cavity again. It's all about minerals when it comes to the mouth. It's all about minerals. That and probiotics, keeping those bacteria in the mouth healthy and happy. So probiotics, prebiotics. I actually have a mouthwash that has a prebiotic in it that encourages good bacteria to grow and discourages bad bacteria from growing. We need the bugs here. We just need the good, happy ones, the ones that are good, nice guys that are going to take care of us as well, help us to digest, help us to do all those things. Red light therapy is great, especially if you have something that's inflamed, if you have gum disease, anything like that, red light therapy is going to help. But really, tooth health comes down to minerals. This is the one question people ask, well, I've been told that I need a root canal. What do I do now? We actually can save teeth. In fact, we get a lot of second opinions, and dentists that are on my directory are going to be able to do the same. We can save teeth with ozone. With ozone, we can keep them alive and prevent root canals entirely. So it really is worth finding a dentist who can have these kinds of conversations with you and help you to find options that are health-based and better for your overall health.
Did you work on Ben Greenfield? Or someone,
No.
I know Ben, he did a whole series, I forget who, a few years ago, getting all that done and shared videos on it. And somewhere,
Yeah.
I guess it was Phoenix, someone was doing it, but I was watching videos of that and how he had to redo all that in ozone therapy. So where can people learn more? Send them, I'll put everything in the show notes, but where should we send them?
Yep. So go to livingwellwithdrmichelle.com and please go there because I have so much free stuff on my social channels, on my website, on my YouTube channel. I am just about helping you to live well. I have a brand new book out. You can go to livingwellbook.com to find out about that. It's about how to simplify your health journey and find out where to start because that's often the problem I hear most is I'm so confused. I'm so overwhelmed. I have no idea where to start. So go there, learn where to start. Dentistry is a piece of it. It's not all of it, but it's a piece of it for sure. And my mission is just to help you live well. So go check it all out.
Wow. So fascinating. I just love this stuff because as I go into more of the health investigation, more clues to put together, the more fascinating it is and more rabbit holes to go down, but really to help people improve to be healthy from the inside out is my goal, sharing that as a practitioner and on the show, so we can thrive as we age and not get older and you have your teeth falling out and your joints weak and you just have this whole just domino effect of health problems as you get older. I feel the need to share this information with everyone, and hopefully you guys can all pass it along because this is such important information that we don't hear enough out there about. So thank you, Michelle.
Thank you.